information as I can, and then you lead me on with questions.
It's always so loud. It's such a shock when we start. But
Fair
good-
warned, right?
Yeah. Good afternoon, everybody. It's 12 o'clock. I'm Lori Yoakum. I am the director at Wilson Public Library. Today is our community chat. We're already in the middle of June. I can't believe that already. But just today we have, oh, and I'm never going to get your last name right, so you're going to have to say that. It's Martha with Community Action
Partnership,
Community Action Partnership of
Nebraska.
Mid-Nebraska. See, I should have just had you start from the very beginning. So she's going to talk about what they all do, because it's a lot larger than what I had first thought. I was just thinking you were a part of Dawson County, which you are, but it encompasses a lot more than that. But before Martha gets started, just a reminder that our July community chat is also on a different day because of summer reading. So in July, we're having Dr. Dan Endorf come. He is COSEC's new superintendent, so we hope you can join us. If not, we will record it and post it to our YouTube channel. And that all aside, we're excited to have Martha here today. And so, first of all, tell us your last name, and then you can just start talking. We'll chat.
Well, thank you. Martha Draskovic, and what I do is I work for Community Action Partnership of Nebraska, which is a nonprofit agency. Community Action pretty much covers 27 counties and 2 out of Kansas. So they have quite a bit of different programs which go towards the benefit of certain individuals that qualify for them. So I guess our most prominent ones that are kind of known the most is our WIC program. So that is part of our company, as well as the RIDE program. So
And we both have those in Dawson County.
Yes.
I know the city council just voted to refund RIDE.
So so that is one of those, and that their director is Charles, who I believe was here previously. So I can go ahead and start. I'll give you one of these little sheets here that let me see here. I didn't know how many I was gonna need, but and then maybe you can just
Oh,
ask
yeah,
some questions about that.
absolutely.
So,
But if you have extra ones, then we can keep them here
oh,
too.
yeah, absolutely. I'll just leave those there with you.
We do get a lot of questions about resources
Right.
for people, so this will be awesome.
All right, so I will start from the top of our program sheet. So our community action agency, we, like I mentioned, we cover 27 counties and then 2 out of Kansas, which out of those, we have community service coordinators. So on the top of this sheet with our programs, we have QR codes. So with those QR codes, you are able to locate any of the community service coordinators, which cover certain areas. So clients are able just to take their phone and actually go over that QR, and it will pull up all the offices. So they can go ahead and contact different community service coordinators within their coverage area. And even if they called one that is not as close to them, we would be able to direct them to the right office. So what we have is about 9 different offices. And they are from Franklin all the way to Superior, North Platte. So there's one in Franklin, Kearney, McCook, Ogallala, North Platte, Hastings, Lexington, Minden, and Superior, which I cover the one in Lexington. So my primary area of focus is Dawson, Gosper, and Eastern Frontier County.
Are you solo in your office?
I am. It's an office of 1.
Okay.
So most of us have multiple programs that we run out of 1 office. I am lucky enough that I'm in a building that does have other programs that are part of our company, like WIC, Head Start, and immunization.
And where is your office?
It is 931 West 7th Street. There in Lex. So as you're coming into town on Highway 30, I'm right behind the Farmers Cafe next to Doran Post.
Yeah, okay.
So, yep. So
It helps that I grew up in Lexington.
Yeah, nice, yes, absolutely. So, I've been trying to spread the word more about our programs and what we do. So I will go ahead and, so that is with our first part of the sheet here. That is us, the community service coordinators. So,
And how long have you been in your position?
I want to say about almost 14 years.
Okay.
So, I started there after college and then I'm still here.
Now, is the food pantry in Lexington over by you too?
Yes, I actually take care of the food pantry there in our building, so that is part of one of my programs there.
So you are very busy.
It is pretty steady, yes. So for our office, for the food pantry, you don't need an appointment. It is Monday through Thursday from 9 to noon and 1 to 4. So as long as our door is open, they're welcome to come in for a food pantry.
Okay.
So we don't limit that to towns or any, it just pretty much if you need it, stop in. Like I said, my area of focus is Dawson, Gosford, and Eastern Frontier County. That does not mean that if they're not within those areas, they can't stop. They absolutely can.
Okay.
They can go ahead and do that. Those are more guidelines towards like specific programs of our company, just because we are guided by income guidelines. So it's easier for someone out of Arapahoe to go to our McCook office than it would be to go to our Kearney office. So
Are all of these the same income guidelines or do they all have different?
all our programs go off the same income guidelines per se. So weatherization has their own, and each program here would be into a different income guideline, yet CSCs, we all have a sheet that we all follow the same. So whatever income guideline would be for weatherization, let's say in Buffalo County is the same income guideline that we would follow in Lexington for Dawson County. So that's why we kind of, it's very helpful to have those community service coordinators there so that it is easier access for individuals who live in certain areas instead of having to travel to Kearney or wherever the program director is.
In general, is there an average income if you're below?
We do. Certain programs can go off, we all go off federal income guidelines.
Okay.
So they're all federal. So mostly it could be like the 125, which can be as low as 30%, or it could be up to 200%, just depending. Weatherization is a 200% program. So WIC, actually, for a WIC program, if they are on Medicaid or SNAP benefits or something like that, they automatically sometimes qualify for those programs. So it just depends where they're at. So there are certain income guidelines for each one. So that's why there's a different breakdown for each.
So the best thing is to actually just QR code, scan that?
You can, yes, and it will take you up to our different programs, and then it takes you down to our company's website. And then in those QR, there's actually, if they're not able to access, there's a phone number right next to it.
That's great.
That they can definitely give those a call. And there will be someone that can go ahead and give them more information about that.
Nice. So I asked you tons of questions you haven't even started. So
No,
I'm gonna be
you're good.
quiet for quiet.
No, you're fine.
while, and you can just talk.
So our weatherization program, I'll start with that one. So it is a federally funded program, which was funded since 1976 by the U.S. Department of Energy, which this program is actually based in its aim to kind of reduce the energy dependency that, by improving homes by adding certain materials that would make your home a little bit more energy efficient. The great thing about this program is actually that it's completely free of charge to the individual that qualifies for it, which means that it can actually be a owner or it could be a rental. So that is one of those things. So it could be an individual as long as they are within our income guideline. So most of our flyers kind of do have a breakdown of what the income guideline is. So what I like to do is, if it is someone that, let's say they live in Gothenburg and it's not as easy for them to come down to Lex, I can definitely mail an application out to them, an intake. However, it is easier for them just to bring it back, and we set up a time in the day so that way we can go over the paperwork and make sure everything is there. So I do like to explain that to them, that it just depends how much, could be invested per home. So they do get a certain amount that can be invested per, dwelling. Their main area of focus for that is like their furnace and water heater inspection. So if it's found unsafe, it can be repaired or replaced, adding insulation into attics and walls, attic ventilation, insulating crawl spaces, insulating water heater jackets, insulating water heater pipes, weather stripping and caulking around doors, windows, and general heat waste areas, repairing broken windows and doors, and possibly replacing them if they're determined cost effective by the national audit.
So you said that that's a free program too.
It is, yes.
So do they have to, they find somebody to do the work and then they submit a bill, or do you find somebody?
No, we actually have a crew. We have a weatherization crew who travels around and takes care of all those needs.
Nice.
So it would be like a whole program from start to the beginning. So we go ahead and start the paperwork process with our company and it ends with our company. So that way they don't have to find their own, I guess, crews to take care of that. Our company actually takes care of the whole thing. So with that, it pretty much, once we are done with the paperwork in my office, it gets submitted to our director's building in Kearney. So they go ahead and keep track of the list depending where they're at. What I understand sometimes is like up to 7,000 that they can invest per home. It really just depends what that audit says it's needed. So, like I mentioned, the individual who qualifies and lives in that home would not have to pay anything to that program or, pretty much pay anything back. Unless there is a stipulation, that they can't sell the home within a certain amount of time
Okay.
after the service has been completed.
They don't want flippers.
Yes,
doing that.
yes. So, however, if it is a rental, of course, we kind of do let the landlord know, hey, this is what's going on. You'll need to take care of this and this first before we go ahead and take care of the rest.
Do
So-
you work with different cities? Their health committees? A lot of times they'll have.
Like Two Rivers and them?
No, like this is, I'm trying to think what they call it here in Cozad, but they'll have like houses that are kind of falling apart.
Oh, okay.
They'll meet, like if it's a health hazard, they'll meet, so the.
Like city inspectors and,
Yeah,
okay. So, sometimes it depends on the program.
or is this something that, if they met the income requirements, they could go
Yes.
check with you about,
Yes.
if they could.
So we don't do any inspections previous to qualifying for the program.
Okay.
So our inspector would go and do a walkthrough of that premise to make sure, that is safe for our crews and the individuals living there. So if it's found unsafe, then we will, of course, let them know, like, this needs to be replaced and taken care of before we can send anyone to work on the property. We don't do major construction with siding, roofs, anything like that. It is more energy efficient for your home. So, but that is the way.
But like if somebody, say, didn't have a heating system in their house or something like that, or there's broken.
So there is another program, which is the heating and the cooling part of it. So those are for individuals who are over the age of 70, or there is a health need in the home and there's a child under the age of 6.
Okay.
So with that one, if it's got to do with heating and cooling and it needs to be fixed, we can definitely look into a program, which actually we use different companies within those towns to take care of those repairs. So there is one for heating and just cooling, but there is an age which is over 70, or there is a child under 6 that there is a health condition. So, but it is very similar to the weatherization program. And again, they would not pay for that service.
Yeah.
So we always do try to reiterate that out there is a company that is, you've received a service through our agency wanting to get anything back. That was not us. We do not ask for that.
So do you work with like in Cozad, it's called Board of Public Works?
Mhm.
Do you actually work with that department as far as they would say, hey, if you're having a problem with your energy bill, You
I
know,
do.
you might check this out, this program.
I don't partner with them that way. They obviously, they definitely are able to refer individuals over. I work with them in the aspect of, part of my job is to help individuals that are in need of utility assistance.
Okay.
So I do partner with them that to try to avoid that disconnect
Yeah.
process. So,
Okay.
we do.
Great.
So in this sheet here actually lists the different counties. And then again, the service coordinator and their phone number.
Super.
So it does give that guideline. Of course, those income guidelines could change. And, so the best bet is just to go ahead and contact a community service coordinator.
Could I maybe get a copy of
Oh,
those to put
absolutely.
in our resources?
I will actually leave it here with you. I just brought some so that I can,
Yeah.
or,
Buenos días, ¿ya se acabó el evento que va a haber?
is there an event going on today?
This is it. We have a book club.
¿Es nada más de información o tienen un club de libros?
No, es que anunciaron en realidad el Facebook, iba a haber un evento que para los niños que les iban a...
Oh, for the children?
Children.
That
Yeah.
was, that ended at 12 o'clock.
Terminó a las 12.
Oh, bueno, gracias.
But we do have a story time on Friday.
Yeah.
Disculpa, la comida que dan en el Güey en Lexington, ¿ya la dan a qué horas? Porque yo fui a las 12 y ya no...
El segundo jueves. El segundo jueves del mes.
Pero ya a qué horas, porque hoy yo fui a las... Iban a hacer las 12 y ya ya habían terminado, ya.
Si me quiere llamar después, es para terminar con ella y luego le doy la información.
¿Cómo va a tardar?
Sí. Si quiere esperar como una media hora tal vez, o si quiere regresar.
Mejor que regrese.
Ok.
Bueno, o sea, ¿a qué hora te vas?
Como faltando como 10 para la 1.
Ok,
¿Ok?
ok.
I know enough Spanish to make me dangerous.
Sorry, I'm just like trying to, okay. Let me see. All right, so we were done with the weatherization one. And of course, I'm bilingual, so I can do both English and Spanish out of the
I was gonna
office.
say that was amazing. I just shifted and asked that.
Okay,
Thank you.
yes, so we will move over to WIC, which is Women, Infants, and Children. So I do have a bit of their information here again, which is income guidelines. They also changed, they are on the federal income guideline. And they start from the time of gestation all the way up to 5 years old. So, the girls here at WIC in our office, they take care of their own appointments. They do all that because they do a screening with them. And then they let them know like, hey, come in at this time, bring whatever it is that they're needing. So they do have traveling clinics. So of what I understand it is their traveling clinics on Mondays.
To
So-
COSA
They do, they travel to Koza, they travel to Gothenburg, all the way to Alma. So they travel around
on Mondays.
on Mondays. And they do have their set hours Tuesday to Thursday in our building.
Okay.
So, they do. And,
Do you know where they meet in COSA? I know a long time ago, they used to meet at the Lutheran Church, but I don't know where they meet now.
I will get that for you.
Okay.
I do, they do have, certain, I want to say it's still there. It's still at the church,
It could be at the Methodist.
as a
Church,
Methodist
yeah.
church, yeah. So I do, I know they do come up here, but they do have different, locations through different
Sure.
towns. But we do have that and I'll forward that over to you.
Super, thank you.
Yes, so this is a supplemental program. It is not intended to take completely full, I guess, to completely
Take the place.
the place of the formula expense. So it is a supplemental program. Typically that family will be in need of purchasing their own formula, like maybe a week out of the month, but they do get quite a bit. So, they do, let them know is, if the household is on SNAP benefits, they are able to purchase formula with SNAP benefits.
Okay.
So that is one of the good things with that. So yes, they can definitely take care of them, from gestation all the way up to 5 years of that child. So,
And I'm assuming like the doctors know about this. so they can
yes,
like-
they, so I work right next to them and I get calls from different clinics, different hospitals. They work very well in partnership with, all like hospitals and clinics, especially if that child has had a reaction to a specific formula. So they do work with them to go ahead and get them a different formula that would be better suited for that child.
It's good to know.
And so my next one is our ride transit program.
So say, that's the one I know the most about. I'm just looking, well, not all of them, I guess the senior centers too,
So
but I don't think a lot of people in COSAD really know about RIDE.
about ride, yes. So it is a great program, especially for our individuals that have a very difficult time accessing transportation.
Now, is this income-based or can anybody use RIDE?
Anybody can use ride.
Okay.
Ride is not income-based at any point. So whatever travel you're needing to do within their designated times, and they have routes from Lexington all the way up to North Platte.
That, yeah.
So, I know I've personally, with case management, with some of my clients, have utilized them to send them all the way up to North Platte to the Social Security office.
Social Security, doctor's appointment.
Yes, so, sometimes it's that dialysis, Social Security, whatever kind of item they need to take care of in North Platte. And then there is also, they go all the way up to Kearney. So just depending which side you need to go, it could be North Platte all the way up to Kearney.
Now, do you have to make an appointment?
You do. In Lexington, you just go ahead and you call Tom. I definitely have their number and it's on these handouts here. He will actually make that reservation for you if you're needing to do that North Platte, just so that they know how many travelers are going.
Now, the QR code, does that like take you, can you make a reservation
You
online?
you can't make anything online. It will just give you
Just
the
have to call.
information of that program.
That's
It
good to
will,
know.
yes, it will give you the information of the program. So one of the things that I kind of been pushing out there is our ride transit cards.
Okay.
So
Never seen those before.
anyone can purchase these off of the driver. And the drivers have them, they're $20. So
$20 and how many rides does that?
so this gets you 24. So it just depends. It is, now is $2 a ride. It used to be $1.
$2 each way?
Yeah.
Okay,
So-
so $4 round trip.
So, yep, and then they give you the special listings of when you're using the boarding gate or wherever you're going. So it will be 12 one-way trips per $20 punch card.
Okay.
So when you get these, I use these for my clients when they're coming to the food pantry and they're walking. So instead of walking all the way across town with it, I can just use one of these. They get on the bus, they drop them off, works great. I know our hospital in Lexington, all different businesses, they'll purchase a card and patrons will just get there. And once it's done, you can just purchase another one. I mean, you can purchase a bundle, whichever ones you need, but the drivers would be able to sell them to you directly. So, and then if there's anyone working with a specific case, as a case manager or anything, you can purchase these for like your client and use those. If they need to go to Lexington for doctor's appointments, wherever they need to go, they can use them in any ride bus for it. So
Is there an age limit, like say a mother has a child? I mean, is that 2 people or?
I am not 100% sure of that, but I think it would be per
Per
individual.
seat?
Yeah, per
Per seat.
individual. And there is a car seat clause which they need to follow. So there needs to be car seats for certain ages.
Sure.
Yes. So some of them I do understand that they do have those ramps that are able to help with wheelchairs and stuff like
Okay,
that.
so they are wheelchair
Yes,
accessible
yes,
too.
yes.
That's great to know.
And I always, if there's any questions, just call Tom down in Lexington. He's very good about explaining and what needs to be done and what he can't and can do.
And I think in COSAD, they come just specific days.
They do, but Tom would be able to give you that information because there is also one in Elwood.
Okay.
So if there needs to be coordination between different ride programs, they can coordinate on different areas that they need to travel upon.
But that's just a good thing to know, especially if somebody doesn't have a ride
Yeah.
to the doctor, that they can coordinate that the date with the ride.
Yeah, absolutely. So that is one of the things that I know in Lexington. Sometimes just that transportation, and I mean, it's all around, the transportation part is very difficult. But, you know, just if we can just get them to those doctor's appointments or whichever one it is that they need in between there, which once they go up to their doctor appointment in North Platte and they need to stop somewhere else, of what I understand, they don't have to pay an additional fee. It is all included in that one fee.
So do they stop at like Walmart?
They
or
can't, yes, it could be shopping, it could be a doctor's, it could be anything.
Anything?
Yes,
Okay.
it doesn't specifically have to be.
And is there times?
There are different times, when they leave and when they will be returning. So, and those are more, like a Tom question, just depending
Okay.
on how busy they're going to be and where they're going. But it just depends. He does like, you know, it pretty much is like a 24-hour heads up, just so that he does know what they kind of need. But I would always just call and see what is needed. But of what I understand, so services are from Lexington, Gothenburg, Brady, Maxwell, pickups and drop-offs, residents wanting to go and travel to North Platte. So they can make stops in between to pick up different individuals in different towns. So, so I will also leave that ride information
Yeah,
here
thank
with you. And my next one is our commodities program. So our commodities supplemental program is for our individuals over the age of 60 who are also income eligible for it. And this is a program that as long as they are income eligible, they can stay on it for as long as they'd like to. So this is pretty much a food package, which is pretty much formulated to address the needs of their protein, calcium, iron, vitamin A, and vitamin C. So I like to say is the reverse solar WIC program for a young one. So what we do is we try to focus on those items that are largely needed for their diet, and sometimes we get away, like we don't prioritize those needs. So we try to do that. And the good thing about this is in COZAD, they come the same day that they come to Lex. So they do come to COZAD, and it's over at your senior center. So I know we have several individuals at the Housing Authority that we kind of, so we're very grateful. The Housing Authority does send over their maintenance and they pick up the boxes for the residents and drop them off at their doors. So even if they're living in housing or they're living at home, whichever one, we can definitely sign them up for the commodities program. So this program usually gives them, it is a package that is designed, it's pre-packaged for 2 months. So they will get food. It's a banana sized box. So they get their canned fruit, canned vegetables, canned meat, canned fish. So their protein, peanut butter, cheese, shelf stable milk, pasta, rice, cereal, bottled juice, and dehydrated potatoes. So they can use these at home throughout the whole month.
So
So
this is different than Meals on Wheels.
yes, it is. Yes,
Can they do both?
they sure can. They can. Meals on Wheels, they'll just have to go through the senior center, and then those get delivered home.
Do they go through the senior center for this too?
They
I
can
mean,
call,
can they pick up an application like this?
I
too?
sign them up
Oh,
for it.
you
Yeah,
sign.
yep. I go ahead and do their paperwork. However, if they're wanting to do it via telephone, they can actually do that as well. And
So
call.
same thing, they can
Yes,
scan?
yep, call them directly, and then they will take their information over the phone. They will give them the time and day that they need to be there. And once they get there, they can go ahead and sign their paperwork at that time as they're picking up their commodities
Do
program.
you ever do anything at the senior center, like you're there once a month, so if people want to sign?
I am not, I, usually what I do is, I was doing one day out of the year, and I was coming up to the Housing Authority, and I was signing up individuals. So that way we can go ahead and do that. However, now, they do come, every 2 months, and they sign up anyone that's wanting to sign up the day that they're here.
Okay.
So that way they can go ahead and get their box at the same time as they're being signed up for it. So it is, they would just need to provide, of course, you know, proof of their income. So if they're on Social Security, we can definitely just look at their bank statement. Whatever is being deposited into it, we'll just look at that. If they have their Social Security statement, we can definitely look at that as well. and then, proof of their address. But, so they are, pretty simple. It does not take us more than 5 to 10 minutes to get the paperwork completed.
Okay.
And our community action, food pantry, food banks, mobile produce. So that is part as well as my job duties in Lexington. I take care of the food pantry there.
But the one in COSAD is not part of this.
It is not.
Okay,
No.
It's just COSAD food pantry.
Yes, yes. So what I do, part of it is, we are a partner with Food Bank from the Heartland, which I believe you guys are as well.
Okay.
So, with Food Bank from the Heartland, individuals who are wanting a food pantry can definitely stop in, and get provided items through USDA. So we get certain items that come from the USDA and we are able to provide to individuals. Whether they are from the state of Nebraska or not, or they're as close as Lexington or as far away as Omaha. As long as it is a USDA product, we can go ahead and help regardless. That is why my pantry is open to anyone that is needing food, whether they're from Lexington or not. So we do that. And like I mentioned earlier, it is Monday through Thursday from 9 to noon and then 1 to 4, no appointment needed. As long as my door is open, they're welcome to stop in for a food pantry. So I also have the mobile produce, which is the same thing that you have over at your senior center,
Yeah.
that second Thursday. I actually have it.
Now, did that start with COVID or had that been going on before?
No, it did. It started in 2020 when COVID hit. So we are in Lexington, we originally started with that to provide a pantry to individuals due to the restrictions that there were about being in buildings and moved outside. So at that point, we actually were contracting with Cashway, and Cashway was delivering those items out of Kearney. And it was like that for years. And now I say for years because it's 4 years later. So now Food from the Heartland has actually taken that back and is now able to deliver as part of one of their routes to different towns as a produce mobile. Instead of
But people still drive through to pick up?
Yes, they still do. They still drive through, and that is open to anyone that is needing or wanting one. There is no restrictions to coverage area or anything of that sort.
Income?
Nope, no income restrictions. They are welcome to just pull up and grab a box.
Okay.
Yes, absolutely. So with that, I do that pantry. I also like to let our individuals know that we do with Foodland Through the Heartland, we actually have a partnership with the state of Nebraska, with the Department of Health and Human Services, which we can go ahead and assist individuals to apply for SNAP benefits. So instead of going through the long wait and the long call or going down to the office, if it's not convenient to go to an office, they can actually call our 1-855 number and do all that over the phone. And
So it's kind of a streamlined process
Yes.
for SNAP benefits?
yes, so we actually, at the call center, they're able to look into whatever processes that they're going through, let them know, like, this is what we need, this is what you need to do. Sometimes it's so convenient and they do most of that process over the phone that the only thing that our individuals need to do is maybe scan something in and submit it or drop it off at the office. But this covers the whole state of Nebraska. It's just not just focused in one area. So they can definitely just call that number and apply for SNAP.
Yeah, so if they need to scan something, then it can come to the library, we can
Yes.
scan it,
Yep,
help
yep.
them email it.
Yes, and that's the way, it's trying to make it more accessible to some individuals that don't have capability of driving to an office. Or
But they could take rides.
they could, absolutely. And with this is they can do it over the phone and using the resources that their town has accessible for them. So, and of what I understand is if they do have an application started with DHHS and they're not understanding what is going on and what they need, they can definitely call this number and go ahead and talk to an operator and they will go ahead and let them know. our system is not tied to DHHS, so you go to a different call center. You don't go through the DHHS call center. So sometimes we have shorter waiting times
Yeah.
than
DHSS is pretty overloaded.
Yes, so I try to push this out if they do
Yeah, I
need
didn't
it.
know anything about that.
Yes, and they absolutely, and if they are going through, they're having a hard time not finding a food pantry or some sort of a resource, if they actually call that number, they will let them know which town would have the next resource available for them.
You call that number, is there, an ability to talk to someone in Spanish?
Yes, yep, they have bilingual staff on there.
Because I know that we've dealt at the front desk with some people, there's a language barrier, but we get through that, and they're definitely wanting to know like the food pantry, when are the hours, and so
Yes,
there's that
yes,
will be great information.
and they do, so even if they were wanting
Do
to
you
call
have
Pam.
that little flyer in Spanish?
It's, yeah, English and
Oh,
Spanish,
super.
yep. So if they wanted to call, Pat over and, say, or just be like, hey, most of us have our business hours registered through them, so they would know what business hours pantries have.
Okay.
So, our senior volunteer program, we don't have one here in Lexington, or our senior centers that we take care of. Those are more of a Kearney program. So I'm gonna go ahead and skip over that. But however, those programs, if they have any questions, they can definitely give them a call. Our senior centers, that they do have, like senior center meals, anything like that is usually through like Minden, North Platte, and the Kearney area, the Peterson Center.
So your senior center, so COSA Senior Center is not a
No.
part of community action?
No.
Could they be?
That would be a good question for our directors there.
For Tammy?
Yes, for Tammy, and they would be able to let them know. I know the one in North Platte is, but Lexington is not, and neither is COSA, but North Platte and Kearney are.
What, I don't want to say qualifies as senior centers part of community action partnership?
I am I'm not really for sure on what their requirements are to be part of the community action part of it. So, but yeah, I would definitely suggest for them to call that number there or do the QR, and they would be able to give them that information.
Yeah, that senior volunteer program looks interesting.
Yes.
What does Kearney do? Or do you know how many volunteers they have?
I don't really deal with the senior centers a lot. I don't participate as part of my program. So it just gives them an opportunity for them to have a place to go and remain independent. And they do have certain activities for them. They have different, so like any of our senior centers, they kind of have different activities of what they can do. I do know that some of them like to volunteer and do certain things there with the meals. So it just keeps a location for them to keep going.
Sure.
So.
I'm sure they do crafts and things kind of like what
Yeah.
we do here at the library.
Yeah, I do. They have different activities scheduled and such. I'm not for sure exactly what it is that they'll have there. My next one here is our immunization program. So our immunization program covers quite a bit of an area. So this one, actually, they're a traveling clinic. So they travel to different locations depending on where they're needed. Here in Lexington, they come to our building every first and third Monday of the month. So with that being said, this is for individuals who have no medical insurance at all. So they're uninsured, underinsured for that. And they are able to go ahead and receive low-cost vaccines. With that being said, they would like a donation of $19 per vaccine. There's no administration fee for it. However, if the individual is not able to pay for that, they do not get that service denied. So they are able to go ahead and schedule an immunization. So at this point, what they do is they do vaccines for children, adults, including COVID vaccines, and any other vaccine that they might have available. We do have nurses that will go over their immunization record and will let them know this is what you need.
Do they do the flu shot?
They do.
And I'm trying to think what else. Chickenpox was the adult version of chickenpox.
Shingles?
Shingles, yeah.
I don't think shingles is one of theirs. Of what I understand, possibly it could be the cost of that vaccine.
Okay.
So, however, any of these numbers will get you to the immunization program, and they will be able to schedule you in. Sometimes they're able to do walk-ins within a certain time. And this one, the only thing is underinsured, uninsured.
Now, do the schools know about that? You know, when the kiddos have to come and.
Yes, yes. So we do like to do that outreach part of it so that, because we do know that there's kiddos out there that sometimes can't make it. However, it covers COSA, it covers anyone in
Yeah.
the area. So
And
even if,
again, take the ride.
even if they're not, they have different counties, like Gosford County, if they needed and, you know, there was the need for it, they could always make a special clinic for it. So they do different counties. They do all these counties. So I'm gonna go ahead and leave that
Yeah.
there as well. And then I think we talked about the weatherization program
Yes.
already. And so I do have also some of those dates and times for different immunization clinics, the commodities, our Lexington WIC number, certain days and their times, and then of course my office on the bottom. So I'll leave this one as well. And is there,
What about the community health worker?
so our community health worker is the one that focuses on our immunization program.
Okay.
So they kind of travel around to give that information about the vaccines and what they're doing, reaching out to different schools, hospitals, letting them know, like, hey, you know, because there are some social workers from different hospitals that would reach out and it's like, hey, I do have this client, but they can't afford this vaccine, or they can't afford. So vaccination can be very costly. So just for them to know if they just need one and they're not covered, the likelihood is that they would be able to get it through us. So they do, that's what the community health worker does, is they try to connect those individuals with health services.
Okay.
Mhm.
Well, you were worried that you weren't gonna have very much to talk about.
I know.
And I keep thinking of all these questions. Oh my goodness.
No, absolutely. There is so much that the company provides. It's just hard sometimes to kind of filter all that information out there to everyone. But yes, and like I said, the likelihood of something like this being in a county where anyone can just have access to is very large, and should be able to find a community service coordinator. Even though we only cover certain areas in Nebraska, there are other community actions. So Broken Bow, that's not our coverage area, but they have one there. So Custer County does have a community action. They just go through a
It's
different.
not like our district type of thing.
Yes, yes. So, but programs, the likelihood that they have those programs over there is very large as well. That's just part of a different area. Doesn't mean the program is not there and they can't access that.
My one question for you is, like, if all these tables, all these chairs were filled, who would you want to hear your spiel?
I honestly feel like it is for everyone.
Yeah.
Because
But I mean,
there's-
like in COSA, who haven't you talked to yet that you would really like to say, hey, I would love to talk to you a little bit about what?
Well, you know, that is one of the things is maybe more like city offices that can give that information out, because sometimes as the frontline person, you kind of see a lot of things that the people in the back don't get to know or don't get to see. So it could be someone, you know, like clerks at the utility company. They know all this information, but yet maybe someone in the back is talking to somebody and they don't even know that this is available. So I do believe that the company, our agency does have something for everyone to kind of take in mind and realize that there is programs out there. Some of those income guidelines are fairly large. They can go up to 200%. And maybe particularly it might not be us. However, we might have a cousin, we might have a brother, we might have somebody that could definitely benefit off the program. So I do believe that that is one of the things is sometimes our, frontline kind of gets to see, well, this is what the need is, but the people in the back kind of don't get the same information that everybody else does have. But I do feel like these are very beneficial to most of our communities. Pretty much a lot of our communities could benefit of some of these. And that I'm always, just one of them, just apply for it, apply for the program. The Weather Aid Station program is a great program. Some of our homeowners, I mean, they already have so many things to deal with that, just dealing with basic energy efficiency of our home sometimes is a little hard. I mean, things are getting pretty expensive, so I do. So yeah, I hope I kind of covered most
You
of what you
covered a
said.
lot. Which program would you say right now would be the most underutilized program?
I would definitely say would be possibly our commodities and our ride program.
Yeah.
Yes. And I do believe is our commodities, our individuals, some of the time, they don't leave home.
Yeah.
So for them to get that information, that's what I'm saying, it benefits everyone to get a little bit of that information and give it to your neighbor or let them know like, hey, like this is beneficial.
Have you ever, I mean, can you send like a brochure like that with the Meals on Wheels people? Like,
Oh,
they're
absolutely. We
delivering?
have brochures. We reach out to the housing authorities, senior centers. So, what I do is when I do different events that I go to, I try to take most of my flyers. And then what I do is take brochures. So that way, however, I mean, most of us, when we look at a piece of paper, sometimes we just set it
Yeah, well, I
down.
really like your QR codes.
Yes.
And so that was my next question is, how long have you been doing that? And have you found that that has helped you?
With me, I find that it has. So this was actually one of our interns' projects. So she came up with the whole QR thing, which I still think is phenomenal. I love it.
It's brilliant.
Yes, I like to carry these around just because it is like, you just pull out your phone, you can give a client that number, you can actually have that client scan it and it saves onto their phone. So they can go back to that window whenever they need it. So, I mean, of course, if they close that window, however, they already have some sort of an idea of what is out there. So I do, on my office, I actually have them on my bulletin board, so that way they can just take their own phone.
Yeah.
And even if they take a picture of the whole thing, they can go back to it later.
Right.
So, but,
I'm gonna steal that idea.
oh, absolutely.
Because I thought, wow, I could put all of the library's different events on here.
Yes, I find it very, very helpful. I do, especially with everybody being so mobile now and everything a lot to do with phone. So it's very easy access.
So you said you had an intern. What kind of major
So I
was
actually,
that person?
social work.
Social work.
Yes,
okay.
so, sometimes my director will call and be like, hey, we have an intern, so she sends them over, but their main location would be in Kearney. So I get an intern, here and there to help me out with the food pantry and items of that sort, so that way it gives me a little bit more time for my office and I can take care of that stuff. But yes, so that was one of their projects was that they came up with, and actually she came up with it, so it's great.
Well, I so appreciate you coming today. I
Thank you.
learned a lot. I'm hoping that the people who watch are going to
Yes.
learn a lot.
Absolutely, and like they said, if there is a number, it doesn't matter which number you kind of call, they would be able to direct that individual to where they need to go.
All right, well, gosh, we're going on an hour. You didn't
yeah.
think we're gonna be able to talk that much, but I'd like to thank everybody for tuning in today and check back next month with us.